When you think of HIV/AIDS, what comes to your mind? Is it the panic of 1980s, the label of high risk, or is it the illusion that modern medicine has made it disappear? But the truth is, the HIV virus never went away. It just lurked in the shadows. As of 2023, 39.9 million people worldwide will still be living with HIV. That means it's the equivalent of the entire population of New York City. Over time, more and more infected people are also aging. So it brings to the questions, what challenges does aging pose for people living with HIV? And what are some of the ways our community is helping them? Hi everyone, I'm Xiaoying. I'm a rising senior from Cape College High School. I'm really glad to be here today. Over the past 6 weeks, I've had the opportunity to work with Robert Mansfield at the UCSF campus, focusing on public health and community outreach. The project I've been working on is called Building Local Supports for HIV/AIDS Initiatives. So let's go over the background first. Start with how my interest in global and local public health started. As a first-generation immigrant student moving from China to here a few years ago, I deeply understand how information gaps, language barriers, and unfamiliarity with the healthcare system can significantly impact a family's medical decisions. They may delay seeking medical treatment as a result, which has made me determined to help minorities obtain more medical resources and reduce information gaps by participating in community activities. I later joined YBIT, which stands for Youth Build Immigrant Power, to organize workshops to introduce health-related policies and AIDS resources to everyone. This process made me realize that public health is not just about healthcare itself, but the steps in helping people access healthcare. This experience also became the starting points for my interest in public health. And this summer, I had the opportunity to intern under Robert Mansfield, the executive assistant to Payam Nahid. He also served as the treasurer of the AIDS Work San Francisco, and he has led UCSF's AIDS Work efforts for over a decade, and he's also here today. Alongside Robert and dedicated UCSF planning team, including events coordinator Jen Dowd, I joined efforts to support the community coordination and engagement behind AIDS work. My project focused on supporting UCSF's participation in AIDS work by helping with outreach, donation checking, and team engagement. As an activity with a long history, AIDS work was established in 1987 and has always held an important place in people's hearts. And also, the ABC's News has a strong partnership with AIDS work this whole time. Robert this Monday joined the news to talk about the AIDS work. So if you are interested, check it out. And AIDS walk, it's not also like only just an ordinary walk, but also one of the earliest and longest running events in the United States, raising millions of dollars each year to support AIDS patients and programs like Golden Compass. It is a commemoration of those who have died from AIDS and bring together generations of people to fight for social justice and raise awareness of AIDS in society. The following are some of the tasks I work on during the project. During this period, I read several articles about the history of AIDS work and the challenges of aging with HIV. I attended UCSF's AIDS work planning meetings where I gave updates on donation data. I also reached out to captains of each UCSF team via email and created a tribal board to help raise donation in the community. From these articles, I learned about the real-life challenges faced by people living with HIV, especially older adults. Patients over the age of 50 are more likely to develop complications such as cardiovascular disease, diabetes, kidney disease, chronic inflammation, and cancer. HIV can also accelerate aging by 10 to 15 years. Many older adults even give a treatment because they cannot afford the cost. This reflects the importance of unrestricted funding and advocacy. People aging with HIV needs greater medical and social support, especially in today's aging society. Through this project, I came to understand the history and pain behind AIDS work. In the 1980s and 1990s, the HIV/AIDS epidemic swept across the US, especially in cities like San Francisco and Los Angeles. Hundreds of people were diagnosed with AIDS within the US every day. And the most frequently asked question during that time period is, how would you feel if you test positive? following by the questions, would you commit suicide? Due to the lack of effective treatment, people lived in fear, shame, and isolation. And through the AIDS work, I saw the power of small actions makes a real difference. Moving forward, I want to continue being involved in public health and community advocacy. I'll be continuing my internship with Vibit. I'll also be assist production team at ACEWORK San Francisco events on July 20th. If you're interested in it, it's in this Sunday. You can register online. And I will keep diving deeper into global public health. And this internship didn't just teach me about HIV or fundraising, it showed me how small actions and strong communities can lead to real change. And I want to keep being part of that. Last but not least, huge thanks to Robert. Thank you for helping me connect with so many amazing people. I've learned so much from you, from your leadership and support. I also really appreciate all the speakers who gave us inspiring lectures. The ACEWORK SF teams and Meredith Green introduced me about the Golden Compass program. And of course, thank you to everyone here today. You all made this a truly meaningful experience.
Thank you, Xiaoyan. Appreciate that talk. And the plug for July 20th, this Sunday, SF AIDS Walk. Please join if you can. Do you want to? Maybe I'll hand it to the mentor, Mr. Robert Mansfield, first to kick off a little Q&A.
Thank you. Thank you so much for all your hard work. And I look forward to working with you at the park this Sunday. So I know you talked to Dr. Meredith Green, and I wonder if you could elaborate a little bit on the importance of the unrestricted funding that this type of money brings with it.
Okay, so what's special about the ACEWORK is that the ACEWORK event is a unrestricted funding event, like meaning that patients can get financial assistance based on their needs. For example, if a patient wants to get a haircut or want to buy their toothpaste, they can use that money to do that. So that's also the importance of the unrestricted funding.
Great. Other questions, comments?